Seeing your child convulsing is a frightening sight, but not to worry. Today, I, Dr. Susan Fernandes, will walk you through how you can manage a child who is convulsing at home or in an outside space. Convulsion is most commonly due to fever, and those are termed as febrile convulsions. These convulsions or fits occur when the temperature is on the rise for the child or at the peak of the fever. Most commonly, febrile convulsions are at 3 months to 3 years of life. But we have to keep a watch because there could be many reasons for why a child is convulsing. So how do you identify if a child is convulsing or not, or it's a normal movement of the child? A child who is convulsing is unresponsive. You call out their name, they do not answer you. They could be just staring, or their eyes could be rolled up. They do have twitching of hands and legs, sometimes only one hand or one leg, and it can progress to the full body twitching. Arching of the body is also common. At the same time, the child could vomit or have foam coming out from the mouth and pass urine or stool. So what do you do at that time? The first thing is, do not panic. Keep the child in a safe place where he will not fall and harm himself. A soft area like a bed, if it's too soft, is harmful. You can keep him on the floor. And the most important thing is to turn the child or the person to one side. So the head has to be on the side, not straight looking up, because if there is secretions in the mouth, it should not go down into the chest. So keep the child on one side. You can put a small pillow underneath the head. The arm of the top part of the body has to go on one side, and the legs on the leg which is on the top folds over, so the child or the baby can be kept at one side, and you are at a safe place. You wait for the convulsion to stop. If the convulsion stops within 2 to 3 minutes, then you can take your child to the hospital. If it does not stop, we take the child immediately to the hospital as the closest place possible. Also remember, do not put anything in the mouth of the child to keep it open. That's the most important point. Once you're in the hospital, the doctor would administer the required drugs to stop the convulsion. Many a times, it's the second episode or the third episode, by the time you would be given a nasal spray for which you could stop the convulsion at home or in place outside. It's called insert spray or midazolam spray, which has to be carried with your child everywhere the child goes. So that's your first measure to manage the convulsions. Thank you.